Hello, everyone. We are lucky enough to have Dr. Mazur with Urology Associates with us to discuss male fertility and some of the procedures that you might hear of. And first of all, I would like to introduce Dr. Mazur and maybe tell us a little bit about yourself.
Hi, thank you very much for having me. I'm a urologist. I specialize in male infertility and andrology, so it's a area of medicine where we really focus on the male and with difficulties getting pregnant and trying to help them with their journey in getting pregnant. I'm originally from the Chicagoland area. I grew up in the suburbs of Chicago and did most of my training in the Illinois area. I went to med school and residency at Northwestern in Chicago. And then I did a male infertility fellowship after that, so additional training down at Baylor with Dr. Larry Lipschultz. I joined Urology Associates in 2017 out of fellowship to kind of come here and help the males in the Denver market with their fertility needs.
Well, thank you very much for joining us and for answering some of our questions. And I think that we're just going to go ahead and get started. So, we're just going to discuss a few of the more common procedures as far as male fertility goes. And so, we're going to start with a PESA. And so, just a general idea of what a PESA is, how it's treated, that sort of thing.
So one of the most common procedures we do for sperm retrievals is a procedure called a PESA, P-E-S-A. It stands for percutaneous epididymal sperm aspiration. This would be considered on the more minor end of the sperm retrieval procedures that we have. Essentially, the idea is we're using small needles to aspirate sperm out of the structure that's called the epididymis. The epididymis is this structure that is attached here to the back of the testicle. So it's outside of the testicle, but attached to the back. And essentially, when sperm is made, sperm come up from the testicle into the epididymis, and that becomes the vas tube, which carries the sperm out. So that would be what is cut during a vasectomy. So what the PESA is we're going into that epididymis with small needles to try and aspirate some sperm from the fluid in the epididymis. We generally do it under some anesthesia. Sedation is preferred, just for your comfort. This procedure is generally done more in men who have more obstruction issues, not necessarily production problems. The main one that we see is a vasectomy. So when you have a vasectomy, that is the first area that the sperm back up into. So in most men who've had a vasectomy, there's usually still a lot of sperm in that area. So when we do this procedure, those are the main men that we are targeting. There are other men for other issues, which could have other issues with their vas or other obstruction issues that we'll sometimes do it for as well. The procedure is generally relatively quick, but again, we do prefer to do it under anesthesia. Sometimes we only need to do one side as well. So for most men afterwards, it's just some bruising and swelling. If you've had a vasectomy, most guys would say it's the same or even better than their vasectomy. I generally encourage most guys to take it easy for a week, depending how you feel, maybe two. But most men are generally getting back to normal within a few days. But again, that's a procedure that we do mainly for men who have more of an obstruction problem, not so much of a production problem.
And to that point about the vasectomy, would you recommend that if someone is thinking about this procedure and having a vasectomy done, that they would freeze sperm in advance?
So it's always an option for men, but generally most men do not freeze sperm prior to a vasectomy. The reason for that is, unless there are certain things going on where you are affecting your sperm production otherwise, most men will keep making sperm throughout their life after a vasectomy. So we can always go in there and get more sperm. The problem with freezing a sperm before a vasectomy is it's small amounts, usually a couple ejaculations at most, and you still usually have to use that for in vitro fertilization, just giving the small amounts. So if we ever needed sperm in the future, we could usually pretty easily do one of these PESA procedures and go back in and get sperm and get fresher sperm that could be used right away. So that way you're not paying for freezing costs and those sorts of other additional costs. But it is still a very reasonable option, but I think men have to understand that if they're freezing sperm prior to the vasectomy, it's with the thought that if they would use it, it would be for in vitro fertilization.
Oh, great point. Let's get into a TESE, a T-E-S-E. Can you explain to us a little more about that?
So the PESA procedure was designed to go into the epididymis, but sometimes we need to go into the testicle itself to get sperm. Those procedures are called TESE procedures, it's TESE, and that stands for testicular sperm extraction. Those procedures are done more in men who have production problems. So essentially, we need to go closer to the source to try and find sperm. Most commonly, this is done in men who don't have any sperm in the ejaculate. That's a term you may come across at some point called azoospermia with an A. The idea being we're trying to go in the testicle to find sperm. There are other certain situations where there could be an epididymal blockage that we may go in there. But for most men, it's when you don't have any sperm in the ejaculate and you have not had something like a vasectomy. It's a little bit of a larger sperm extraction on the grand scale of surgery, still pretty minor, but most men for this procedure are getting put under with a general anesthesia to make them more comfortable. Because these usually do involve us having to make an incision on the testicle. Sometimes we will start with some aspirations on the testicle, but if there's a severe production problem, we have to go into the testicle. So we make an incision on the scrotal skin and then an incision on the testicles, and essentially take a biopsy out of the testicle. If men have a more severe problems, we have to do a procedure called a micro-TESE, which is essentially where we open up the testicle a little bit more and go through it with a microscope and actually survey all the tubules to see if we find areas that look a little more distended, which generally can be a sign of possibly sperm production going on, and essentially take a bunch of small biopsies from the testicle. Sometimes we will do both sides if we don't find anything on one side, but that's part of the discussion we have with men on their case, if it's something we need to do both sides or one side. It's a little bit more involved of a procedure, so that's why we often have to do it at a surgery center or hospital because of the anesthesia requirements. But we work closely with the embryology team with this, and usually we'll have a member of the embryology team in the operating room with us to be looking at the specimens to see if we're seeing any sperm or what the quality looks like. Because if we do find areas of sperm production, we tend to get a little bit more from that area. It's a little bit more healing process because it's a little bit more involved than the aspiration procedures. Most men will have some dissolvable stitches on the skin. But I tell most men it's a good 2 weeks of taking it easy down there, mainly from strenuous activity, things that could really just irritate the scrotum. But it's usually dissolvable stitches. Whenever we do any of these sperm retrieval processes, we always try to get some extra if we can so that it can be frozen for you. Many times we do these procedures fresh, but sometimes we will do them and freeze the sperm as well. So if we do them fresh and there's extra, then, and the embryologist thinks it's reasonable, they often will try to freeze it just in case you need it for future use. But sometimes we will just do it ahead of time and have them freeze it. In some situations, there may be some extra considerations or hurdles with that, so that may not be an option for all people. But in some situations, we will do it ahead of time and freeze it. But that's a discussion between kind of the physicians and the patient, depending on their situation. But generally, if we can, we try to do these procedures fresh. So one less variable to add to the mix with kind of freezing the sperm. We can do these procedures more than once as well. The aspirations are a little bit easier. I've had several patients for various reasons who've had several sperm retrievals over the years. The TESE procedure, we have a discussion about that because the retrieval rates go down the more times you go in. You can get some scarring in the testicle. So there's always a balance between, obviously, we would like to get you pregnant, but also we need to be concerned about your own health and your testosterone production going on in the testicle as well. So that's something else we talk to the individual about.
Oh, nice. And in the event that on the day of the egg retrieval, the TESE is performed and that is under general anesthesia, is that correct?
Yeah.
And so typically what we see with an egg retrieval is that the partner or someone is there to, take the woman home or back to the hotel or wherever after the egg retrieval. But in the event that the males do go under general anesthesia, that they will not be able to take them back because they both had anesthesia. Would that be correct to say?
Correct. If both partners are getting anesthesia the same day, then you do need a ride home. It's just not safe if both people have had anesthesia to be driving home. So it's definitely something that needs to be coordinated with the facility you're getting things at to ensure that you have a ride. Sometimes we will do the male procedures, particularly those micro TESEs the day prior to the egg retrieval. So sometimes the male will get the anesthesia, and then he can drive the next day his
Mhm.
partner to her egg retrieval. So there are sometimes some variations in the timing, but most of the aspiration procedures are being done the day of the egg retrieval. So as part of the planning process, it's always good to have a ride available, particularly if both people are getting anesthesia.
Perfect. Wonderful. Thank you. And then a varicocelectomy. What exactly is that?
So one of the other more common procedures we perform in the male infertility world is a procedure called a varicocelectomy. So while the other procedures we have talked about are involving sperm extractions, this is a procedure that we do to try to improve sperm quality or count. So a varicocele essentially is dilated veins. These veins that are draining the testicle have become dilated. I have a little picture here. I know it gets very anatomical, but sometimes pictures help. So over here is the normal testicle, and over here we see these veins draining the testicle a little bit more dilated. It's a very common problem. It's an anatomical issue. It's nothing that you could have prevented or something that you caused, but we see it in 15% of all men that we examine for various reasons will have a varicocele, and the left side is more common. It is a smaller percentage of that 15% where it could cause a problem, and those two problems are decreased sperm count or motility, and sometimes chronic achy scrotal pain as well. Essentially, the idea is that there's more extra blood pooling in the scrotum, and that can heat up the scrotum. And that makes it harder actually for sperm production to happen. That's why the testicles kind of go up and down when it's hot and cold, because the testicles are trying to maintain a slightly lower temperature, which is optimal for sperm production. So the varicocele can affect that. Most commonly, what we would see with a varicocele, it's diagnosed by an examination. You can sometimes see them on ultrasound, but not always, depending on how it's done. But it's based off examination. But on the semen analysis, the most common parameter changes that we see are a decrease in the sperm count and a decrease in the sperm motility, so how they're swimming. Sometimes the morphology is down as well, but the impact of a varicocele on the shape, the morphology, is a little bit more controversial. So the procedure itself, it's also an outpatient procedure. This is something you would do before you're thinking about going through the actual fertility treatments, essentially trying to improve the sperm production before you want to use that sperm. We usually make a small incision very low in the groin on that side, again with you under general anesthesia, and then we go in with a microscope and actually look at all the blood vessels draining the testicle. We also use a little probe called a Doppler probe, which looks for all the blood vessels as well. But those are essentially things that just help us identify the structures more easily and add more safety to the procedure. We find those dilated veins and we essentially tie them off so that the blood flow can't go backwards. We have to leave one or two of the smaller veins so that there's still some drainage from the testicle, and then the testicular artery and the vas deferens so that things can still flow and function like the testicle otherwise would. Procedure usually takes about an hour, and then people go home the same day with some dissolvable stitches on the skin. You can be a little sore down there for a little while, even though it's just a skin incision. It's in the groin, so tell most people for a few weeks, I don't want you to do anything too strenuous because I don't want you to tear open that incision. But most people, rebound pretty quickly, but obviously sore for the first few weeks. I think the biggest thing people need to know with a varicocele is, and anything that we think about with sperm is, sperm can take almost 3 days from the time they start dividing till they actually are ready to come out. So if we do a procedure like a varicocelectomy, we often want to wait at least a good 3 months before we check another semen analysis, think about maybe wanting to progress forward with our fertility treatments to try to give that time to recover down there. And the interesting thing is, even if we don't see counts and motility increase, there are plenty of studies that have shown that just the fact of fixing the varicocele does still improve the quality of the sperm. In the setting of in vitro fertilization, they've shown higher fertilization rates when you fix a varicocele versus a group of guys who don't, who otherwise have pretty similar parameters. So that's a very common thing that we do. And all things considered, it's still a pretty minor procedure, but in some people, it can really help them a lot.
Do you find that with this procedure that they can try naturally after having this done?
Sometimes it depends how much of an improvement you get. I always encourage people, particularly as you're going through things, as long as there are sperm, you can always try. You'd be sometimes surprised with the numbers and how sometimes some things work. But sometimes, depending how much you get, it could boost you into a range where it's a little bit more feasible to think about a natural pregnancy, or sometimes maybe even boost guys or into a range where like the IUI, the insemination procedures are maybe more of a realistic option. But we definitely know, like I said, even if the counts and the numbers don't improve, particularly in the in vitro fertilization setting, we definitely know that men generally do better when you fix those.
And in the event that one of these procedures is needed to do IVF, how often do you think it's important to have a donor sperm available just in case after the procedure there might not be enough sperm or quality sperm to fertilize the eggs with? What are your thoughts on that?
So thankfully, with modern technology and the beauty of IVF, they can work with very small sperm numbers. So as long as there are reasonable sperm numbers going in, depending what we're doing, or if we're just worried about a blockage and not a production problem, for most men, they generally are not going to need to resort to a donor sperm. However, I think the men where it's important are the men where we are not seeing any sperm in their ejaculation, and we're needing to do one of those TESE procedures, because then we don't know if we're even going to find any sperm. In those guys, it's obviously a very personal choice between the male and his partner. But in those situations, if they're open to it, I definitely think it is very reasonable to have donor sperm as a backup if they're open to it. The benefit of that is, well, if we don't find any sperm, then they already have donor sperm available that they can use with the eggs right away, as opposed to having to try to freeze the eggs, which can be done, but that adds, again, more variables and steps into the process. But if otherwise you've had a vasectomy, or you just have a lower sperm number, but still reasonable, for most men, it's generally reasonable to try
Okay.
using their own sperm.
Great, thank you. And then just a general question about men's health that you might have an opinion on. Are there lifestyle changes or anything as far as same things that can affect sperm count quality that you can try before moving to IVF?
Yes, I think one of the most common lifestyle things that we see is the effect of marijuana on male fertility and sperm production. There's a lot of data now on marijuana usage and a negative impact on sperm production. Obviously, everybody can be different. There are men who use marijuana who may not have an impact, but there are a decent number of guys where you can see a decline in their sperm counts and motility. Interestingly enough, the THC receptor has been identified on actual sperm itself. So we know that the molecule itself can actually directly affect sperm. So we can see decreased counts and decreased motility and sometimes decreased shape in that as well. So I think one of the easiest things, particularly if a man is using marijuana regularly, is to minimize that or stop that, and that sometimes may help. One of the other things that comes across, I wouldn't say it's super robust data, but sometimes it does affect some men, is it's the same concept as a varicocele. Your testicles like a little lower temperature to make sperm. So things that are going to cause a lot of extra temperature down there can affect sperm production as well. The classic things that are talked about are kind of soaking in water, so a jacuzzi or a hot tub or a hot bath, sometimes a sauna as well. Sometimes those can decrease sperm production a little bit as well. So it's just something we're really more cognizant of as we're going to go through lifestyle things. However, though, the biggest one I think we see these days is testosterone usage.
Mm.
So it's very interesting. You know, a lot of men who take testosterone, low testosterone is very common. However, most men think, and sadly still a lot of providers do as well, that taking testosterone will help their fertility because it is a male hormone. But it's interesting, the testicles and the brain talk in a loop, so they communicate with each other. So when a man actually takes testosterone, it actually suppresses how the brain talks to the testicles. And in most men on testosterone, the testicles actually go to sleep. So they actually, many men who take testosterone, sperm production stops or goes very low. So we see it very commonly that men are taking testosterone and wondering why they're having trouble getting pregnant. And then we check a semen analysis and it's often quite bad. Thankfully, that's usually something that is correctable or reversible, but sometimes it takes some time and some weaning and some other medications from our end. So it's definitely something we see a lot and we can help with too.
And as far as sperm regeneration, after testosterone use, how long do you see that it takes sperm to return to like a more normal count after stopping testosterone?
It can be highly variable. The thing that's the biggest variable is how long the man has been on testosterone. So the shorter the amount of time, the faster the recovery. I've seen it in 3 months. Generally, we're talking months here. 3 to 6 months is probably reasonable for most men on testosterone, particularly if we're stimulating them with some other medications to try and push it along a little bit faster. However, I've seen it take 6 to 12 months, and some men have been on testosterone for a long time.
Okay.
But again, we can try to speed that up sometimes with some alternative medications to try and stimulate the testicles.
And in the event that someone is stopping marijuana use to do IVF or to try and get pregnant, how long would it be before when you should stop, and then when you should try for IVF or try naturally, or how long does that usually take for that regeneration to
Yeah, I
happen?
mean, the sooner the better, but you may not see a change in the semen parameters for 72 days or 3 months
Hmm. Okay.
uh, on average. So.
And do you have an opinion? We live in beautiful Colorado where everyone is outside for most of the summer. Do you have an opinion on long bike rides in the mountains or wherever? If that's a you shouldn't do that if you're trying to get pregnant. I have had people ask me, so I'm curious.
Yeah, I generally like men to be active because it keeps them healthy for their health, and
Hmm.
you know the keeps them thin. The one thing that can throw off your testosterone otherwise lifestyle wise is a lot of weight gain. So staying active definitely can help that. So I would say generally that activity I would favor more than a man being a couch potato. Most of the stuff, yeah, the concern usually with bike riding, and I know there's some anecdotal things and some things that people talk about, but the thing that's more associated with bike riding is actually more erectile issues than actual fertility issues.
Mm.
If a man's wearing very tight shorts and it's compressing it, I would say that's controversial. We'll talk about that with their biking shorts. If you get really whacked down there and get significant scrotal trauma, now that's usually sending you to the emergency room. That could be a problem with biking. But for most men, it's not necessarily the biking itself that's going to affect their sperm counts. The nerves and the blood vessels that go to the testicles actually come down through the groins. So they're actually kind of more in the front. The nerves and the blood vessels that go to the penis actually come up from the bottom, kind of where the bike seat would sit. So there's more stuff out there that if guys particularly have those bike seats that are causing their genitals to go numb, it's much more of a potential impact for their erections over the long term and for their sperm production or testing.
Oh, very informative. Thank you. Do you have anything else that you'd like to add that you hear a lot of, or that people might be curious about?
Well, I think the biggest thing here is, in a couple's fertility journey, I think a lot of the focus is on the female. And I think that's where a lot of things start. And I think a lot of that comes from women who have been more in tune with seeing a gynecologist, much of their adult life, whereas many men, young men, particularly, have not been getting medical care regularly. But I think it's important for couples to know that it's very important to investigate the male. It's about 25% of all the infertility issues are male related, 25% are female, and 50% are a mix of both. So that's potentially, if 50% or more, depending on the situation, that could be male kind of factor fertility related.
Hmm.
I think it's important to look. I think some of the couples, can get frustrated if they've waited so long and they realize that there actually is a male factor too. So it's just an important part of the journey. This is a journey that takes two people, so we need to make sure
Yeah.
both.
No, absolutely. That's a great point. And I really appreciate you taking the time to educate
No
us,
problem.
as always. You've given us such great information. And I do want to point out that if you just watch to the very end, we will leave the phone number and link if you would like to schedule a consultation at Urology Associates with Dr. Mazur. And if you have any other questions, you can just reach out to us directly at Conceptions. We would love to help you in any way that we can. And again, thank you for joining us. Thank you for all of this important information. And we look forward to seeing you again soon. Thank you.
Thank you.